Hello, this is your nurse Edwin again. Today I will be discussing about peripheral IVs, or sometimes they call it as PIV or IVs. These catheters are placed for the administration of drugs and or fluids when the patient or when a patient is unable to eat or drink sufficiently. It is also being used when one is prohibited from drinking or eating for medical reasons. So, or it is also a condition that requires medications via the blood. It is also common to use an IV catheter like IV catheter for taking blood samples. So once it is placed for the above reasons, the benefits are to save the patient from additional venipuncture and to save time at the same time. So the catheter is for short time use only. Most common is 1 or few days only. So how to choose the right IV catheter? Per INS standard or the Infusion Nurse Society standard, the rule of thumb is to choose the smallest needle possible or the smallest catheter size possible to maintain maximum blood flow around the catheter or the hemodilution that we call. So a small catheters also minimize the risk of damage to the blood vessel. Always remember, always remember this, that you have to consider the purpose of placing the IV catheter and assess the patient's blood vessel carefully. Never use a larger catheter size than necessary. The IV catheters are color coded depending on the size. Like say for example, there is like 24 gauge is color yellow, 22 for gauge 22 for blue is color blue. So the color is correlating to a gauge size according to the applicable ISO standard. So the higher gauge size, the smaller diameter of the catheter. So the biggest diameter of the IV catheters is 14 gauges, I believe, and the smallest is 26 gauge. This is a bit contradictory, so keep that in mind where to place the IV catheter. So the most common site for an IV catheter is the forearm, the back of the hand, or the antecubital fossa. So the catheters are for peripheral use and should be placed where veins are easy to access and have good blood flow. So although the easiest accessible site is not always the most suitable, avoid inserting the IV catheter close to the flexible joint where it may bend, because a bent or a kink catheter can be a source of complications. So the veins in the antecubital fossa are often easy accessible and also big, but note that this is often bent joint with high risk to kink the catheter. But if there's no other reason where to place the line, then you can place it. Especially those nurses working in emergency room, they use the antecubital fossa to access the vein. Again, always assess the blood vessel carefully. Use your eyes and fingertips. Look for as straight veins as possible and palpate for good elasticity and filling. So try to avoid, as I said, the stiff, very thin veins or veins under sore skin. For the smallest patients, like the babies, neonates, the veins on the ankle close to the foot are often preferred due to easier access there. So consider this an IV cannulation procedure. So when the best vein available is identified and the right size of the catheter is chosen, so our next step would be insertion. You have to remember that the first success should always be the goal. So any additional attempt you have to consider this of insertion increases pain and stress for the patient, adds also workload for the caregivers and cost to the healthcare system. So you always have to consider some other measures that would help kind of find the vein. Like for example, using a heating pad with caution to increase venous distension and make the veins more visible and accessible. So it is very, very important to observe the flashback of blood to know when the needle is in the vein. Flashback will be visible in the chamber connected to the needle as soon as the needle is in the vein. Always continue and insert an additional of 1 to 2 millimeters to let the catheter, not only the needle tip, reach the inner lumen of the catheter. Continue to insert only the catheter and carefully withdraw the needle at the same time. So you will now see blood between the catheter and the needle. The second flashback, which confirms that also the catheter is in the blood vessel. When working with small babies, neonates, or patients with small and fragile veins, it is important to have an instant blood response. For this reason, with our smaller sizes like the gauge 24 and 26, the needle is notched in a very precise way in place to facilitate blood flashback, because this speeds up visual feedback because blood immediately appears between the catheter and the needle in front of the wing housing. So now, as soon as the needle is out, you immediately need to close off the lower end of the IV catheter, either with a white cap that comes with the product or with an extension line or needle-free connector of your choice. Always fixate the IV catheter carefully to keep it in place and in a stable position. Use transparent dressing the insertion site to facilitate regular inspections. So you might also need another layer of protection, such as a tube or a gauze, to further protect the IV catheter and minimize movements and vein irritation. So before any infusion or injection, it is always important to confirm correct placement of the catheter and good flow. Flush the catheter with a saline and ask the patient if he or she feels the cold coming up the vein. If, for example, if the patient is not communicative, you have to place your fingertips of your non-dominant hand, the one that you are not holding the syringe, at the level of the catheter tip and feel the cold yourself. So always look for any swelling in the tissue. So, and also check for any other complications. So after placing an IV catheter, always flush the IV catheter with saline after each usage to prevent from clotting of blood and be able to use the catheter for as long as it's indicated. So attaching an extension line is a common recommendation in guidelines. So the extension line could possibly increase the indwell time of the IV catheter, as because it enables the medical staff to operate away from the catheter. So, and then also at the same time, it minimizes the risk of contamination and movements. Again, remember to fixate also the extension line to avoid getting caught with it. Hanging like it's like hanging from the hand or arm. So be careful with the skin and place a piece of gauze underneath the end of the extension line with its stopcocks or needle free connectors. So always make it as possible, always make it as comfortable as possible for the patient. Again, this is your nurse, Edwin. Thank you for listening. I hope you learned something about this today. Thank you.